I found it very interesting in your talk that you suggested not putting in IV catheters to administer euthanasia. And can you tell me a little bit more about that?
If they're already in place, then of course they're useful. But we know that catheter placement is painful, and to remedy that, we use a topical anesthetic in other patients. But these cats are particularly likely to be painful, and so the chances of maladaptive pain, like allodynia even, or at the very least hyperalgesia. So we think that the experience of catheter placement will be different for these cats, and we want to avoid anything that might be painful for them.
If somebody elects to go ahead and put a catheter in, what is a good way to minimize the pain associated with that?
Actually, the topical anesthetic with a bioocclusive dressing, the problem with it is it takes about 20 minutes. So if there's time for that and the resources available to do it, and the client is okay with it, then that would be the way to put a catheter in.
So for some of these really debilitated older cats, there's a couple of different euthanasia administration routes that you talked about in the session, and I found particularly fascinating and probably going to be very useful. And one was the IP route, and the other is the intrarenal route. And I would really like for you to compare and contrast the two and talk about the pros and the cons of both and when to consider using them.
The intraperitoneal route is very helpful for a client who wants to hold their cat and wants to have a little bit longer period of time with them, because it takes a while for the intraperitoneal route to work. And so if the clients are comfortable having that extra time to be with their pet, they can hold them in their lap. You don't have to put the cat in any particular position to administer it. Those are some of the things that are helpful. The only disadvantage is it does take a while, so 20 minutes maybe. And so some clients want to be gone in a shorter period of time.
And then talk a bit about the intrarenal route, and I think it's helpful to also mention that these cats should be heavily sedated before we're administering the euthanasia solution, correct?
Any route, they should be heavily sedated, because we want to make sure that there's no suffering, no anxiety, no fear.
And then talk a little bit about that intrarenal route, because I just found that really fascinating, and I didn't really know about it.
It was information presented at a meeting of the AVMA last summer on euthanasia, and the advantage is it's immediate rather than the IP route. The disadvantage to me is that you have to be able to palpate the kidney so that you know where you're going, so there's a positioning issue that might be specific for that, and as someone in the room pointed out, it's more difficult in fat cats.